Hi, my name is Kim Konecki, and I'm your pharmacist for today. Today we're going to be going through some of the medications you can expect to go home on upon discharging from the hospital after your bone marrow transplant. There are two different types of bone marrow transplant, either an autogeneic or an allogeneic transplant. And depending on which type of transplant you underwent, this will definitely vary some of the medications. You will be going home on a variety of medications, and these will include antibiotics, antifungals, and antivirals. It is very important to keep taking these medications until your doctor tells you to stop. And this is because after a bone marrow transplant, your white blood cell count is not at an optimal amount in order to fight off infection. So that makes you more susceptible to any sort of bacteria, and any other type of fungal pathogens. You also will be going home on electrolyte supplements such as magnesium or potassium supplements, and these can be given orally or intravenously. You will also be going home on GI tract medications such as antiemetics, and antiemetics will help reduce some of the nausea that you can experience after transplant. The anti-nausea medications can include medications such as Reglan, Compazine, or Decadron, and your doctor will tailor these medications according to the amount of nausea that you are having. You can also go home on anti-rejection medications. If you did undergo an allogeneic transplant, then you will most likely need anti-rejection medications, and these include medications such as tacrolimus or FK, CellCept, and steroids. Tacrolimus is the medication that we need to obtain blood levels in order to monitor the therapeutic levels. So you will need to be coming into your physician's clinic or office so that we can get those blood samples to make sure that your level is at its best potential to decrease rejection while at the same time limiting toxicity. The other medication that you can expect to go home on is a growth factor shot. After transplant, when your white blood cell count is low, we will usually give you a growth factor shot, which will boost up your bone marrow and hopefully increase the white blood cell count so that your body can fight infections on its own. Other important things that you may go home on are analgesics to control some of the pain, and these can either be taken around the clock or as you need. And also maybe some medications to help you sleep, because sometimes after transplant patients can have difficulty sleeping. And also we can send you home on medications that can stop any sort of itching, which is a common side effect after transplant as well. But the medications will be tailored to your specific issues and problems as you discuss with your doctor. And keep in mind, even after discharge from the Nebraska Medical Center, we are more than happy to answer any questions that you may have about any of your medications or any other problems that you're having while at home. So feel free to contact either the pharmacist here or your physician. Thank you.